Greetings everyone. Today the class will be based on endodontic case selection. So coming to the introduction, the goal of endodontic treatment is to preserve the tooth as a functional unit within a functioning dentition. So that is the primary goal. So as such, the endodontic treatment, it has to be integrated with a comprehensive treatment plan, which is not only going to include restorative but also the periodontal and the overall health of the patient. For success of such periodontal treatment, various factors including case selection is going to play a pivotal role in the success of the endodontic therapy. The selection of cases for endodontic therapy should take into consideration the prognosis of the endodontic, restorative, and the periodontal procedures. It's also essential to consider the patient's needs, attitudes, and willingness to accept the treatment. The clinician should also take into account the patient's medical condition and the motivation to maintain oral health. So why is case selection essential? Because it leads to successful endodontic procedure like RCT, helps to build a good doctor-patient rapport. It makes the patient confident about the future endodontic and dental procedures, and it also makes the doctor confident about his or her own treatment plan. So coming to the indications for endodontic treatment, it is indicated in cases in teeth with pulpal inflammation, in teeth with periapical pathosis, and wherein there is going to be a fractured teeth or when there is trauma. An intentional root canal treatment is indicated in drifted or over erupted teeth, and in case of abutments, teeth which are going to be used as abutments of a crown support. Coming to the contraindications of endodontic treatment, in case if there is a non-restorable teeth which has got extensive caries, or if there is a teeth with vertical root fracture, or if there is a non-strategic teeth which cannot serve in occlusion or as an abutment after endodontic treatment, the teeth with root canals which are not accessible or which are not suitable for instrumentation or periapical surgery, wherein there is a presence of a calcified or severely curved canals, or the patients who have got severe systemic conditions. In such cases, endodontic treatments is contraindicated. Now, a few medical conditions also must be taken into consideration and which can be seen as a contraindication for endodontic treatment, such as a disease related medical conditions such as congenital heart disease, where there is a heart murmur, rheumatic fever, where there is a prosthetic valve, or where there is a patient with pacemakers. In such conditions, the endodontic case selection is going to be crucial. Now, in such cases wherein there is a chance of an infective endocarditis being developed, according to the AE 2017, a few prophylaxis has been recommended in such patients to prevent the occurrence of infective endocarditis. So, in the indications are wherein there is a prosthetic cardiac valves, wherein there is a prosthetic material which has been used for cardiac valve repair, such as annuloplasty rings and cords, wherein there is a previous history of infective endocarditis, or when there is an unrepaired congenital cyanotic heart disease, or if there is a repaired congenital heart disease with shunts or valvular regurgitation, and when there is a cardiac transplant with valve regurgitation. In such cases, prophylaxis is definitely mandatory. So, and not only that, if the drug which is usually indicated is amoxicillin, in case the patient is not able to take oral medication, then ampicillin or cefazolin is been recommended. If the patient is allergic to penicillin or ampicillin, then cephalexin, clindamycin, or azithromycin is been recommended. And if the patient is allergic to penicillin and is not able to take oral medication, in such cases, cefazolin, ceftriaxone, or clindamycin is been recommended. Now, not only that, a few blood-related conditions are also being should be taken into consideration before endodontic case selection, which includes hemophilia, leukemia, thrombocytopenia, aplastic anemia, platelet disorders. In such cases, there is an increased bleeding tendency, which can lead to uh, loss of a huge amount of blood. Not only that, a few diabetes mellitus related conditions also are should be considered, such as when there is a blood sugar must be controlled in some cases to avoid the patient from going into a diabetic or hyperglycemic coma. Not only that, in such cases, non-epinephrine containing anesthesia and non-aspirin containing analgesics should be prescribed, and the patient is it must be remembered that the patient is more prone to infection, so all precautions should be taken. Not only this, a few lung and kidney related conditions can also cause the change in the drug which is being administered for analgesics in case of pain relief for the patient. Now, the factors which are going to affect endodontic therapy includes the teeth with no strategic value, wherein there is a restorative support or periodontal support. Such cases, endodontic uh, therapy should not be performed, and on based on the clinician's efficiency and the systemic conditions of the patient. So, these are the factors, important factors that must be considered during endodontic case selection. Now, the other factors which can complicate and increase the difficulty of an endodontic case include calcifications, inability to isolate the teeth with a rubber dam, or in case there is a resorptive defects, if there's an extra roots or canals, in case of retreatment cases, presence of opposed ledges and perforations or other factors which could complicate uh, the endodontic case. Now, the AE has formulated a difficulty case difficulty assessment, which makes it a practical tool which can make case selection more efficient, consistent, and easier to document. So, it is intended to assist the practitioners with endodontic treatment planning. It can also help with referral decisions and record keeping. So, it is going to identify three categories of treatment complexity, which includes patient consideration, diagnostic and treatment consideration, and additional considerations. Within each category, the levels of difficulties are based upon the potential risk factors, and the risk factors are going to influence the practitioner's ability to provide a care at a consistently predictable level. For each level of difficulty, guidelines are given to aid the dentist in determining the complexity of the case. Now, the treatment sequence stage is going to be in this order, that is, initial cause related therapy, that is emergency pulp extirpation, re-examination, that is response to the initial endodontic treatment, corrective treatment, which includes complete root canal treatment and restorative treatment, and maintenance, which is going to measure to prevent the disease recurrence. Now, based on this, how can you evaluate the acceptable treatment outcome? So it is based on clinical features, that is, there should be no tenderness, normal mobility, no sinus tract, no associated periodontal disease, no swelling, no subjective discomfort. And based on radiographic features, there should be a normal, slightly thickened PDL space, elimination of previous radial recency, normal lamina dura, no evidence of resorption, and 3D obturation of the three-dimensional obturation of the canal space. In such cases, the treatment can be considered to be a success. Unacceptable treatment outcome, which includes recurrent sinus tract, predictable discomfort to percussion or palpation, irreparable tooth fracture, excessive mobility, or if there's an inability to chew with the teeth. And based on the radiographic factors, the unacceptable treatment outcomes includes increased width of the PDO space, that is more than 2 mm, lack of osseous repair or size of the lesion, lack of new lamina dura formation, and there is a new radiolucency, or if there is a missed canal, that is there is a visible painted canal space, or there is extensive overextension, or if there is a void in the apical area, and there is a definitive progressive resorption. In such cases, these are unacceptable treatment outcomes. So to conclude, it is evident that case selection is influenced by both systemic and local factors, and proper judgment of these factors are going to lead to successful treatment outcome. Dental professionals should have the technology, methodology, and scientific rationale to repair damage to the dentition that was viewed as irreversible a few years ago. These advances allow the patient to keep their natural dentition with a few exceptions. And all of the treatment options which are offered to the patient must be in the best interest of the patient and in his health as a primary goal. The treatment must be delivered in a predictable manner by the treating practitioners to optimize the healing potential. Thank you.